We are here today to share with you a change that we are doing at the Apollo hospitals. In oncology, we are driving site specification practice. That means our consultants focus on one part of the body. The importance of this is that it improves outcomes. We have better survival. At the same time, we are now emphasizing on holistic care. And when I say holistic care, I mean we are improving survivals as well as concentrating on the quality of life of our patients. And towards this, we have now started focusing on launching support groups. Support groups are important in the care of cancer. They help support patients, as the name suggests. Patients get together with other patients, share their problems amongst themselves, along with specialists and doctors. Colorectal cancer support group is very important because this is the commonest gastrointestinal cancer. It involves parts of the gut or the gastrointestinal tract, and very often patients have problems because this has to do with the passage of stools and flatus or gas, which is a problem and must be controlled, must be supported so that the patient can maintain a good quality of life. Particularly when this affects the lower parts of the colorectal region, that is in the rectum. Patients sometimes have artificial openings in the abdominal wall to help the colon clear its secretions. So it's important that we have support groups, and this is one of our attempts towards delivering holistic care to our patients with colorectal cancers.
Colorectal cancer is sixth most commonly diagnosed cancer in India. It is also the most common gastrointestinal cancer in India. Incidence of colorectal cancer is rapidly increasing in young population. Every year we see approximately 75,000 new cases of colorectal cancer. Small proportion of these patients will require or will undergo a colostomy or stoma as a part of their treatment. Living with colostomy or a stoma is not easy, and these patients face multiple problems which are unfortunately not dealt with. To overcome these concerns, we are launching a dedicated colorectal support group, which will include patients, their families, doctors, and other caregivers. All of these will share a common platform where they can help each other to overcome the day-to-day life issues. We are launching dedicated colorectal helpline number, which will be available 24/7 for our colorectal cancer patients. We are also launching dedicated stoma care clinic, which will have a dedicated interstomal therapist who will address and take care of various aspects of the day-to-day stoma care of these patients with colorectal cancer.
In the last few years, incidence of colorectal cancer has increased, more so in a younger population. And commonly symptoms which patient do come is bleeding per rectum, which can be easily made out, and that's the reason why we are seeing still patients who are coming in early stage. Lot of new things have happened in the field of medical oncology. Now we have a personalized approach. Many times we need not give chemotherapy, and lot of survival has improved. That's the reason what is more important nowadays is not only treatment, it's the after effect of chemotherapy and the survival which we should be more concerned. And that's the reason why care of stoma and further treatment is very much required.
Today I am going to talk about colorectal cancer. In very short, just explain what molecular targeted therapy and immunotherapy is. In colorectal cancer, we have the option of giving targeted therapy. There are drugs such as cetuximab, panitumab, which are based on precision oncology, where we are tailoring the treatment for the patient based on his requirements, based on his type of disease. The same holds true for immunotherapy. Colorectal was one of the first cancers where we tried immunotherapy, and in the right patients where we have an MSI status which is high, we have immunotherapy working wonders, where patients, the average survival for a stage 4 metastatic patient has gone from a few months to a couple of years now, provided we use the right treatment for the right patient. There are various advances in cancer now, things have changed a lot. Please discuss these options with your consultant or your doctor who is treating you for cancer.
I was speaking on the use of radiation therapy in rectal cancer. There has been a paradigm shift in the management of rectal cancer, wherein we use radiation therapy prior to doing surgery nowadays, rather than after it. We use two different schedules of radiation, one which is a long course where you give 25 sittings of radiation over 5 weeks. The other is a short course of radiation therapy given over 5 days time. The basic idea of giving radiation is to deliver the maximum dose to the tumor and minimal dose to surrounding normal structures. We do have all the modern facilities like IMRT, image guided radiation therapy, volumetric arc modulated therapy in our department.
The treatment of colorectal cancer have evolved over the time. So there are advancement in surgical techniques, chemotherapy and radiation therapy techniques. So from conformal radiation techniques to the image guided radiotherapy, the radiotherapy has played an important role in the treatment of colorectal cancers. The more advancements are with the addition of artificial intelligence in the treatment of these rectal cancers, such as adaptive radiotherapy, so that we can track the tumor and we can see the size and adjust our radiotherapy treatment accordingly.